could you go ahead and just talk to us about Indy, your dog, and how this all started?
This early this year, 2022 is when I took her in the first time
Hmm.
to have her, one of her teeth was half there and there was a growth on it.
Hmm.
So I took her into the vet and I just told him, I said, she needs her teeth cleaned because she was 12 and it was time. And could he just remove the mass? And I didn't want it biopsied because I wasn't going to do anything about it anyway.
Hmm.
And I was already giving her just CBD for years. And the place that I was getting mine from didn't have full spectrum for dogs. So I just got what they had for her, the higher dose.
So it was an isolate product?
Yes, just
Gotcha.
the CBD. Yeah. And I think it was like 500 milligram per bottle. So
Okay.
it was not a huge high dose. So we did that. She got along well for about a year. And then one day I was traveling in the car with her and noticed she had this black mass by the same place that she had that other mass where they'd removed that tooth.
Okay. So she had a mass in her mouth and it was black in color?
It was black. It was black. Yeah. And her gums had been bleeding for a little while, but I knew that there was a chance that she had cancer from before, but until the mass got big, I hadn't seen it, and she doesn't like to open her mouth. She's a dog. So I took her to the vet that day and he biopsied it and removed it. And it took about a week to get the diagnosis back, but he told me right away he thought it was definitely cancer. And he recommended getting CBD, but he said he didn't know anything about it, but that he thought that maybe I should check into it. So while she was at the vet, I went to our local Firehouse pet store and talked to them, and there they recommended full spectrum. Mm-hmm. Well, I had full spectrum because that's what I was using. So I just started giving her mine, and then one day I was watching a YouTube video and you guys' commercial popped up. And I was like, okay, well, I have to look into this. And then I found the pet CBD.
Sure.
But she started getting better once I started giving her my full spectrum. Mm-hmm. But once I got yours, she took a good turn. She had more energy. She was eating better. She just kind of turned back to herself. It took about 6 weeks for her to kind of get back to normal.
Gotcha. And that was the 3,000 or was it, what was it?
I ordered the 3,000.
Gotcha.
Yeah. It was more affordable to me at the time. I wanted to see how it worked. Yeah. And so she was getting 0.25 milliliters 3 times a day. So she's really not getting a total full dose, but I started with that and it seems to do the trick.
Awesome. Well, giving it to her 3 times a day is really beneficial because it keeps it in her system. Right. Mm-hmm. So it's constantly fighting whatever it's fighting. So when did the veterinarian say, the cancer is no longer present?
He hasn't seen her. He hasn't seen her since then. It was May. May was when the biopsy was. So it's been 6 months. He told me, he said she has months.
Oh, she has months of
she
what?
She has months to live. She has
months to live.
He said she just has months to live. These are very fast growing. And they bleed.
Gotcha.
And I thought she had quite a bit of bleeding before the CBD kicked in for her. So once it kicked in the mass, it stopped bleeding and then it shrunk.
Okay.
So I don't know if it was just the vascular properties of it, but yeah, he told me she had months. He said now she could be one of those that it's a couple years. Mm-hmm. But I don't think it'll be more than a year to 2 years, if that. He said, my prediction is months. But I haven't taken her back. It's been 6 months, and I have been thinking about it, but I just haven't done it yet.
Gotcha. Okay, so she's outlasted his prediction. But at the same time, he said it could be a year or 2 years. How is she doing physically?
She's doing well. She has arthritis in her back, and I notice when I give her the midday dose, she seems more comfortable. Mm-hmm. Because she gets the carprofen, which is doggy ibuprofen,
Yeah.
morning and night. But we go for a walk at lunchtime, and it seems to kind of make her really stiff. But I give her that midday dose about 2 o'clock, and it seems to relax her. She takes a good nap. She looks comfortable. She's not limping. So she's got pain relief from it too. But I just looked in her mouth a little while ago just to see what it looked like in there, because I'm kind of one of those ostriches. I don't want to know. I don't want to see. When it happens, I'll deal with it. So I looked inside, and actually I took a couple pictures. She actually was cooperative enough for me to take a picture of where the tooth is missing. There's nothing there.
That's awesome.
Nothing there. Yeah, it's empty. Yeah. She did have a little bit of a cough at first too, and I thought, well, is she getting some, is it spreading?
Yeah.
And that has gone away too. She seems back to her normal self. She gets into trouble. Even for a 13-year-old dog, she still gets into trouble.
Yeah, so one thing we recently did with the pet tinctures is obviously we turned it to an RSO. We started using the RSO in it, and I added extra CBGA, which is an antiviral. So there is some immune system support in there as well. So hopefully that will help with anything that's going around. We did that specifically because, with cancer patients, their immune systems are usually compromised. So having that extra antiviral support, is beneficial to their health.
Yeah.
So
yeah.
Glad to hear that.
Plus there's that dog virus going around.
Yep.
And so I've been making sure she's not around other dogs because it's kind of scary, but she's doing really well. Her coat's really thick and long and soft and shiny. She was there. I had a couple times where I had to, I was cooking her food, and then I switched her to I got tired of doing it. So I switched her to a good brand through the pet store, and she just went downhill on it. And she didn't look good. She didn't feel good. So I switched back to cooking her food again. She kind of perked back up, but I wonder if maybe the cancer was part of it and I just didn't know about it yet.
Yeah, could be. Dog food is very important too. Giving them, a mix even of some fresh food mixed with kibble, but having those fresh nutrients that they're able to eat and get value from is very important as well. So. But yeah, we have 2 rescue dogs, and one of them, when we got her coat, was very thin and very, I don't know, like spiky. She's a short hair, but now her coat is a lot thicker and softer, so.
Yeah, I just saw she just didn't want to do anything when she, when I was feeding her the regular kibble. So, and then when we got the cancer diagnosis and it was in her mouth, I was glad I had switched back to softer food because I didn't think she should be chewing anything hard. And then, but now she seems to be fine. She's playing with her ball again. And before she wasn't playing with the ball because, she wants to make it squeak, and you can't squeak it if your jaw hurts.
Yeah.
So yeah, she's playing with her ball again. She jumps up on the furniture. She's not having a problem with that. So I'm really happy with the way things have turned out for her. I keep looking at her, calling her my miracle dog.
Yeah. Well, she's 13, right?
Yes, she's 13. Yeah. Yeah. And I looked at her and said to my daughter, I said, does that look like a 13-year-old dog to you? Because it does not look like a 13-year-old dog to me, Well,
awesome, Judy. Thank you so much. I'm looking forward to hopefully hearing back that she's, outlasted not just 1 year, but 2 years and 3 years and on. So,
Yeah, I took her to the ocean. We go to the ocean just about every year, but I took her to what I thought was the last time this last summer. And now I'm like, well, I don't think that's the case. I think we'll just do whatever we need to do and keep on going.
Well, the next time you visit the ocean, come out to Long Beach, Washington, and visit us out here. So
okay, we usually go to Westport. So
Westport, that's not too far.
No, it's not too far. But yeah, that's a great idea. I do wish I lived closer to you guys. That would be nice to be able to just walk in and get what I need. Yeah.
Yeah, the locals love it. That's for sure.
Yeah, I'm very grateful. So I really appreciate all the research and everything that you do, and how compassionate you are with everyone you're involved with. Whether they're a customer or not.
Yep, absolutely. I'm very passionate about my pets, and I feel that everyone else is the same way, and I want to make sure everyone's taken care of. So.
Absolutely.
Awesome. Well, Judy, thank you so much for your time. I greatly appreciate it.
Not a problem. Thank you. Nice to meet you.